Hello again. So for chapter 20, the topics I'm going to cover are capillary exchange, venous blood return, and then two of the special circulatory routes that are also going to be covered on your vessels exam. So for capillary exchange, the mechanisms that are involved to move stuff in between, either from your capillaries to the tissues or from the tissues into the capillaries, are driven by either diffusion, transcytosis, filtration, and reabsorption. So these forces work during capillary exchange, combining to are pushed through via either the net filtration pressure or the colloid osmotic pressure. So when you have diffusion, you have a movement of your molecules or your solutes from an area of high concentration to low concentration. So for our capillaries, our area of high concentration for our oxygen and nutrients is located inside the capillaries themselves. So in our case, this is the arterial end, this is the venous end, and then your waste and carbon dioxide on the outside of your capillaries in high concentration in the tissues. So for diffusion, you pass through this membrane of the capillary going from high concentration, for example, let's go focus on oxygen and nutrients, high concentration on the inside of the capillary to the outside, either moving through the intracellular clefts or a type of filtration pore called a fenestration. So depending on the molecule you have, if it's lipid soluble, it's actually able to move through that endothelial cell, where it's able to move through that the lipid bilayer. If it's water soluble, then it has to go through either the intracellular clefts, which are in between the cells, in between those endothelial cells, or the filtration pores. So for example, molecules like proteins that are too large to go through your intracellular clefts or filtration pores they're too big, so they're actually are trapped in the plasma that's in the blood and the capillaries. And so that concentration helps drive colloid osmotic pressure, which draws water across a semi-permeable membrane to an area where there's higher concentration of a solute. So with your net filtration pressure driving fluid out of your capillaries, so bringing out the oxygen and nutrients, those hydrostatic pressures from the blood pressure pushing out against that capillary wall, and then the suction from the tissues also bringing out fluid from the capillaries, driving oxygen and nutrients out. The opposing force is your colloid osmotic pressure, which is the pull from the proteins that are inside the blood, driving water into the capillaries, fluid into the capillaries. Is the opposing force that brings your waste and CO2 into your capillaries, so they're able to be taken away back to the heart through your venous system. So with your capillaries, you have your hydrostatic pressure, which is the physical force of blood pushing against the capillaries, pushing your fluid out of your capillaries, and your opposing force of your colloid osmotic pressure driving fluid into your capillaries. Your capillaries are able to reabsorb about 80% of the fluid that they filter out. So the other 15% is absorbed in the lymphatic system and therefore returned to the blood later. So going through your entire lymphatic system and then returned at the level of your superior vena cava. So there's variations to the capillaries reabsorbing that 85% of the fluids that they filter out at the arterial end. So your variations are depending on location due to function. So the first one are the glomeruli in your kidneys. Your kidneys are devoted to filtering of blood, so they don't reabsorb fluid. And then your alveolar capillaries, so these are the capillary beds around those air sacs in your lung. Their purpose is to completely absorb or completely reabsorb all the fluid that's filtered through so that you don't end up with fluid building up into your lungs and preventing you from being able to breathe. So in the case of activity or trauma where either histamine is released, which causes your gaps between your intracellular clefts to widen, allowing for more fluid, and depending on how big they get, even sometimes proteins to be escaped through those intracellular clefts. Higher activity, so let's say, for example, exercise causing more blood flow through your system can stretch out your capillaries and allow for more exchange there. So that causes a difference in your how much is actually pushed out. For example, higher blood pressure causes your net filtration pressure to increase, and as long as higher net filtration pressure due to the higher blood pressure adding to it, because of that, you can actually end up with swelling where you have a fluid buildup in your tissues called edema. So that swelling is what that's called. With that edema in your tissues where you have that fluid buildup because you have too much pressure being pushed out and not enough being either reabsorbed through the colloid osmotic pressure or through your lymphatic system, that causes that buildup of its fluids. So in extreme cases, a excess fluid in the tissue, so just general exercise will help, will cause a little bit more, but eventually will drain off. But if it doesn't drain back into either the circulatory system or the lymphatic system, it'll cause the edema or the swelling. So this is through increased capillary filtration, so more fluid being pushed out of your capillaries. So for example, your kidneys are not filtering the way they should. Histamine release, which increases the size of those intracellular clefts. Old age, which possibly could be just due to people with older age having higher blood pressure. And then lastly, poor venous return, so lack of that circulation going through the system. If you have less return of your fluids from your venous system, then they'll stay in those tissues versus being brought back towards the heart. Other cause can be reduced capillary absorption, so with hypoproteinemia, so too much protein in your blood, drawing those fluids into the capillary layer, into the capillaries. Sorry, no, that's the wrong way. Hypoproteinemia, so it's not enough protein, therefore less osmotic pressure driving fluid into the veins, therefore it stays in that tissue region. Protein deficiency works the same way, having not enough protein in your blood for you to drive enough colloid osmotic pressure to drive fluid into your capillaries. Then the last one, your lymphatic system that takes up that last 15% of the fluid that is pushed out of your capillaries. If there's not enough drainage from it, so if there's something that blocks those lymphatic vessels, then you're not going to get that flow of that fluid back towards your heart. So in this case, for example, removal of lymph nodes if you've had an extreme infection, and so they end up getting blocked, and so therefore you don't have that full circulation back to your heart from your lymphatic system. that could cause swelling in the body. So consequences of edema or tissue swelling is first consequence could be tissue necrosis or tissue death, because you have a buildup of those fluids in your tissue space, and this causes a hindrance to the oxygen and nutrients going from your capillaries into your tissue space. Also, your waste removal is impaired, so all that toxic buildup, instead of it being removed and going back to your heart through the venous system, it stays in those tissues. Next consequence, pulmonary edema. So this is when you have a buildup of fluid in your lungs. Therefore, you're not able to breathe like you should, and therefore suffocation threat. Cerebral edema, that's buildup of fluid in your head region. So there's enough stuff crammed up in there. So when you add swelling to those areas, causing pressure against your nerves can cause your headaches. Depending on which nerve it might be pressing against, you also can cause nausea. Seizures, possibly due to the altered state of the electrolytes and therefore altering the electrical activity in the brain. So for a seizure, that's when the electrical activity of your brain all syncs up together versus being different depending on the activity of that particular part of your brain. And the last one, your severe edema or circulatory shock, is when there's so much fluid in that tissue space that it's removed the level of blood that's circulating around in your circulatory system. So with that low blood volume, leads to low blood pressure, since there's not enough fluid to actually push against and cause enough blood pressure to keep things circulating through your body. So moving on to the venous part of your circulatory system, so returning blood back to your heart. There's multiple ways of pushing the blood back to your heart through your veins, through either your pressure gradient, gravity helps. There's the skeletal muscle pump, the thoracic pump, and cardiac suction. So fluid moves from an area of high pressure to low pressure. So in the venules, so that's your vessels that are immediately after your capillaries, the pressure, it ranges from 12 to 18 millimeters of mercury. And then by the time you reach the vena cava, which are the major blood vessels that enter the heart, the pressure drops to about 5 millimeters of mercury. So you go from an area, not much of a difference, but still higher pressure in the venules, through the veins, and back up towards your heart, being a lower pressure area of your about 5. Gravity just does its job. It's, if you're, for example, standing up or sitting up, gravity is able to drain blood from your head and neck region. In your limbs, you have your skeletal muscle pump, so those large muscles in your limbs, they're able to push against those veins when they contract. So we have our muscles on the outside of the vein, and when they contract, they push the blood up through those valves that help control backflow on your veins. And once the blood is pushed up, then they're trapped by that next section of valves that control blood flow, and either the next muscles or another method that I'm going to go through can help continue to push the blood up towards the heart. So the last two methods of venous return, you have your thoracic or respiratory pump. So when you inhale or breathe in, your thoracic cavity expands, which drops the pressure inside your lungs since their volume increases, which causes a fluid movement or the air to go from high pressure outside your lungs to lower pressure inside the lungs, so breathing in. When this happens, your abdominal pressure increases, so the area of your intestines, stomach, all that area. When that pressure increases, it pushes against those blood veins and therefore pushing the blood back up towards the heart. The last method is cardiac suction. So when those atrial chambers relax, therefore having an area of lower pressure but not yet moving fluid through, when the pressure in there drops enough, then that blood will be sucked into the heart, going from an area of higher pressure in your inferior and superior vena cava into the lower pressure area space of the atria. Moving on to the two special circulations in your body. So the first one is dealing with your blood flow to your brain. So from your internal carotid, so you have a left and a right internal carotid, which are located here and here. So those blood vessels, as well as the basilar artery, which goes across your pons, So this artery here, those arteries feed a special structure called your cerebral arterial circle, also known as your circle of Willis.